Okay, so I've been assigned to do screening so that I can find out what is causing the problem. Can I go ahead? Anything I can do for you around here before I proceed? Thank you, I'll be back to do the procedure. So during OSCE, after you get permission, sanitize, and on the table there will be plain papers near the examiner. So just get a plain paper and a pen, and then you sit strategically. So you get a chair and position your chair nicely. So when you're dealing with a patient of the opposite sex, you need to position your chair in a solar manner. Solar manner, S stands for squarely. When you look at our legs are going that side, mine are going this side. Like this, the world is very much safe and very much better. But if you are dealing with a patient of the same sex, if it was a man here or a gentleman, we can face each other, it's okay. Unless he's gay, then the problem is there. But the reason for sitting like this is to avoid unnecessary disturbances. And you don't sit close like this. The next thing, she'll start moving her legs. Our knees will start hitting each other. And then from there, feelings will start. Because we are made up of feelings. And when you are facing each other, you'll find that patients will come with emotional problems. Where she's crying, she wants someone to hug, or he wants someone to hug. So if you're facing each other, the knees will hit each other, you look into the eyes for each other, and then you even start hugging. From there, we have a relationship, not a solution. So that's why we maintain a solar manner. So even at the ward, you need to sit in this particular manner. Then O stands for open posture. The way she's putting her legs, that is open posture enough, even if you are wearing a skirt. You are not supposed to cross legs when you are dealing with a client. When you cross legs like this, it shows that you are anxious and you're not in control of the situation. Like this, it doesn't give courage to the patient you are dealing with. So you need to maintain an open posture. When you're watching TV, always observe the way HH sits. Even if he's talking to another person, his legs are always open. Or if he's talking to the American president because he wants to borrow money, he will put a four corner. A four corner doesn't show that you are you are anxious or you are begging for something. It just shows that you are comfortable. But many, they put a four corner when they are, or they cross legs when you are begging for money. But you rarely see him crossing legs. It's because when you have an open posture, it shows that you are in control of the situation. Then L means lean forward. You don't lean backwards like this. You're even asking. So at Zinayam, you're even doing a leg like this. No. You need to lean forward. It shows that you are ready to attend to that person. Even when you walk into anyone's office, even if you find me seated like this, immediately you walk in, you find me doing like this, showing that, oh, I'm ready to listen to what you have come with. So even at the hospital, you need to lean forward so that the patient knows that you are ready to attend to them. Then solar manner, what is the next? E means eye contact. As you are talking to the patient, you don't need to be like you are proposing, you know, what's your name? You are even doing it like, no. Or you are facing elsewhere. Also, Zinayam Nimavandan, you are even talking to someone behind. No, you need to maintain the eye contact. The reason is because you are using a bit of observation. If she's frowning her face, it could be that she's feeling pain. So when you're doing history taking, you're using your nose, your eyes, everything to see changes on the patient so that you record them as abnormal changes, and it will help you give you a clue as to how the problem is being felt. Then R is relax. You don't need to be doing your legs like this or chewing a pen or being uncomfortable. You need to relax. Whatever problem she has, it's her problem. It will never be my problem. Never in my life. It will remain her problem. The only thing is that I'm here to help her go through whatever problem she has. I saw one student, she started crying because she was dealing with an 8-year-old child who was raped. How do you start crying? The child has been raped. Are you going to reverse the problem? The answer is no. So you don't start crying, you know, men are dogs, they are animals. How can you do this? No. you need to relax because that is not your problem. If you start crying, who's helping who? So you need to relax. Don't do anything with your legs like you're anxious, you are chewing pens, you are touching your hair. No. Feel relaxed. It gives the confidence. Okay, so that is just a principle that you adopt. Then after adopting this principle, you don't mention it during OSC. You just sit and start. Okay, so the name you said you are Miss X. Okay, so you even record. You'll be recording as you are asking. So Miss X, how old are you? You are 21 years. Okay, where do you come from? Lusaka. Okay, any specific area within Lusaka? Garden Park. Okay. Are you married, single, or cohabiting, or in any Cohabiting is a legal relationship. It's just that you don't know, maybe you're hearing it now. I can choose to stay with her for advantages and disadvantages, of course. But it's common, especially with nurses. You find that when you start working, you find yourself in Lusaka. Now, because the living standard in Lusaka is high, and then you remember to say, oh, there is the Joseph I used to learn with from Mosa. And then you find each other maybe at UTH. And then you say, oh, Joseph, let's start staying together. From there, you have a relationship. It's going to be termed as cohabiting because you're not married. It's still a legal relationship. So use those. You reduce the pressure on yourself. So, Miss X, are you married, single, cohabiting, or in any relationship? You're in a relationship. Married, cohabiting. Yes, staying together. You're just in a relationship. You are engaged. Yes, you need to be specific. Okay, let's be together relationship. But at the hospital, find out which relationship. Be specific. It will help you know what it is. Then the next question is, Miss X, what do you do for a living? Okay. Then what's your religion? Christian? Okay. With your education background, is it safe to say tertiary since you have said you are a student? Okay. So Miss X, what has brought you to our screening room? Chest pain. Okay. So chest pain. So Miss X, how did this chest pain start? Okay, it started when you carried the heavy loads. What heavy loads were you carrying? Or water. Okay. So where exactly are you experiencing this pain? Is it the entire chest or maybe just part of the chest? On the back. So front and back. Just the back. Okay. So posterior portion of the chest. Okay. Then Miss X, for how long have you been feeling this chest pain? Okay. So which is about approximately 7 days. So when the patient says about a week, use days. When the patient says, I'm experiencing pain on the back, you say, don't say on the back. You use anatomical description. You say posterior portion of the chest. So the doctor will actually shout at you for writing English because there's no English in science. There's only anatomy. And then you appreciate the anatomy you are running away from. Okay, so Miss X, when you start experiencing this pain, how exactly is it manifesting? Are you having maybe problems with breathing, or is it a sharp pain, or when you bend it is becoming more? How exactly are you experiencing this pain? Okay, so Miss X, what do you think makes you to feel this pain more? Maybe is it when you lift something, when you're sleeping, or when you're seated or standing, or what do you think it makes it worse? And Miss X, when you are feeling this pain, what do you do to relieve the pain? Do you rest or take anything? Okay, so lying in supine position. Okay. So since you started feeling this way, have you taken any drugs? So Miss X, on a scale of 1 to 10, how would you rate the problem that you have? Is it maybe 5 out of 10, 6 out of 10, or 10 out of 10? 8 out of 10? Or 6 out of 10? Meaning at least the pain is then manageable. Okay, thank you. So Miss X, we are suspecting chest pain due to upper back. We are suspecting chest pain due to upper back pain. It could be you would have injured your spinal cord, and that's why you are feeling this discomfort. Nevertheless, we are still going to send you for some more scans and investigations so that we come up with a definitive diagnosis. In the meantime, I would advise you just to lie flat when you're experiencing any pain. We won't give you any drugs until some results come back. Thank you so much for allowing me to do the procedure. I'll be back to tell you where to go to next. Then in OS, you even sanitize and then say I'll document and report to the ward in charge. Okay, that's all. So when it comes to history taking, at the end of the day, you need to